Welcome to the Remedy One channel. This channel is about simple life skills to manage everyday challenges. Please subscribe to this channel for more informative content. Today's topic is cuts, wounds, and bruise. A cut can happen anywhere on your body. Many times we get cuts or wounds from falls or stepping on sharp objects, e.g. blades, knives, needles, broken metals, broken glass, etc., in most cases in form of an accident. There are a few ways to determine if the injury warrants medical attention or can be treated from home. A cut or a bruise may not seem like a big problem, but sometimes even a small wound can affect your health. A small cut can lead to the development of an infection. Thus urgent attention is required for all skin opening. Further, if doctors could educate patients on these easy remedies, they would equip the everyday citizen with the knowledge to proactively treat wounds immediately after the injury. Unfortunately, taking antibiotics and using chemical disinfectants for every tiny little cut or bruise can be harmful to your body, which is why you should opt for natural cures. Overall, these natural healing solutions can lower the risk of the potential infections and complications that hinder the healing process. If the cut stays open while healing, your scar may be larger than if the cut was closed. But you can get treatment later to make the scar smaller. When deciding whether or not to seek medical attention, consider the location of the cut. A cut on your hand or foot may be more likely to get infected, and one over a joint may continue to split open without stitches. Any medical problems you already have, such as diabetes. The amount of bleeding. If the wound is deep and or the bleeding is not controlled by consistent pressure, you need to seek medical attention. If the wound is from an animal or human bite, you should contact a medical personnel. First aid for cuts and lacerations. Stop the bleeding. If you cut yourself, the first thing you should do is apply pressure with a clean bandage or cloth, and keep that part of your body elevated above the heart, if possible. Once pressure is applied, do not repeatedly remove the dressing to check on the cut. Doing so can disrupt the clotting process. The body has a normal mechanism to clot, so when you apply the pressure then remove that dressing, you've dislodged a clot and you tend to bleed more. If the bleeding is heavy or does not stop after you apply consistent pressure, you need to seek medical attention. Clean the wound. Every cut has the potential to become infected, so once you have controlled the bleeding, you should rinse the area with tap water. Studies have shown that cleaning with tap water was as effective as using sterile saline. Many people tend to use too much of peroxide or betadine, which can be toxic to the tissues. Use an antibiotic ointment. Most people use Neosporin. It doesn't clean the wound or affect healing, but it will diminish the chance of infection. Cover the wound. Once you've cleaned the wound and applied antibiotic ointment, dress it with a sterile bandage. Change the dressing. It's important to change the dressing frequently if the wound is draining. If it's a relatively dry wound, changing the dressing once a day is appropriate. Get stitches for deep wounds. You likely need sutures if the wound is large and or exposes fat or muscle tissue. Pressure and elevation isn't controlling the bleeding, and the wound is over a joint. When appropriate, tissue adhesive may be used as an alternative to traditional stitches. It's basically super glue that can be used in different wounds. It works best for small wounds that are not cosmetic or over a joint, as regular stitches can help reduce scarring. It is used a lot more in kids because there is no pain involved. Watch for signs of infection. Keep an eye on the wound and watch for changes, as every cut carries a risk for infection. Signs of infection include redness, swelling, pus or drainage, excessive pain. If you are in a high-risk population like diabetes or an autoimmune disorder, or the injury is on your hands or feet, you should pay special attention to any signs of infection. Seek medical advice if you notice anything suspicious or the cut is not healing properly. Get a tetanus shot. Most wounds are not tetanus-prone wounds, however, if you get stuck by a dirty nail or something exposed to dirt, those are more likely to be tetanus-prone wounds. Make sure you have a tetanus booster shot every 10 years, as a general rule. If you get a cut, you want to make sure you had a tetanus shot within the last 5 years to reduce your risk of infection. If you are not sure about your risk for tetanus, consult a healthcare provider. How to treat a cut at home. Most cuts can be managed at home. Cuts from a sharp knife/blade or a piece of glassware are very common. They often occur while people are preparing food, washing dishes, even crafting, or it can be an accident. All it takes is a slip of the knife or a dish breaking, and suddenly there's blood. However, while these types of cuts are startling, most can be safely treated at home. To treat a minor cut: 1. Wash your hands with soap and water. 2. Wash the cut to prevent infection. Use cool or lukewarm water and a mild soap or cleanser to gently remove dirt or debris. 3. Stop the bleeding. Apply pressure to the cut using a clean washcloth or gauze. Maintain pressure for 1 to 2 minutes or until the bleeding stops. 4. Apply petroleum jelly. This will help keep the wound moist for faster healing. Make sure you apply it continuously until the cut heals. To help prevent the spread of dirt and bacteria, consider using petroleum jelly from a tube instead of a jar. Do not apply topical antibiotics. 5. Cover the cut with a sterile bandage. This will help protect the cut and prevent it from reopening. Change the bandage daily, and keep the cut covered until it heals. 6. Consider taking over-the-counter pain medication. This can help relieve pain from cuts. 7. Make sure your tetanus vaccination is up to date if your cut is from a dirty or rusty object. If you aren't sure, contact your primary care doctor. As your cut heals, if you notice any signs of an infection, such as pus or increased redness, swelling or pain, call your primary care doctor. Applying a host of commercial ointments on the wound may or may not help the wound to heal, but some of the kitchen ingredients may work wonders. We have some home remedies for cuts and wounds that you can try. However, you will have to be a little careful while trying some of these home remedies. Avoid using these natural ingredients near the eyes. If you haven't known what these ingredients are, we have your back. Here are severe natural, effective remedies to heal cuts, bruises and wounds. In case of major injuries, please resort to medications under supervision. Use saline solution instead of hydrogen peroxide to rinse the wound. The first thing to do after you get a cut is to thoroughly wash it. An old misconception is that hydrogen peroxide is the best thing to use, but it can be damaging to the skin and not 100% effective against bacteria. Saline solution, on the other hand, is perfectly safe and considered to be the best method. How it works: combine 1/2 teaspoon of salt in 8 ounces of boiling water, allow it to cool, and then gently apply it to the wound with sterile gauze. Turmeric. The humble kitchen spice is a natural antiseptic and antibiotic agent that can help cure infections, has been used for years for its medicinal uses. The curcumin in turmeric helps boost wound healing by modulating collagen. If the wound is bleeding, apply turmeric on the wound, bleeding will immediately stop. Also drink a glass of turmeric milk every night before bedtime to heal completely. Turmeric also has properties that help reduce inflammation and purify the skin and blood. There is no better natural remedy to cure cuts and wounds than powdered turmeric. Honey. Honey is used for medical purpose and is one of the most effective home remedies. Works as an antiseptic on open wounds. Applying honey on the open wound helps dehydrate the bacteria from it and keeps infections at bay. Can be used on cuts on the tongue. Honey stimulates the immune system, which speeds up recovery, and controls skin inflammation. Honey has antifungal, antibacterial, antimicrobial and anti-inflammatory properties. Apply honey if you get a cut. Tea tree oil. A drop or 2 of tea tree oil is essentially all you need to get rid of pimples and blackheads. Similarly, you can treat open wounds and cuts with the help of tea tree oil. Tea tree oil is full of anti-inflammatory and antioxidant properties, It also has antibacterial properties and it helps provide relief from pain due to its anti-inflammatory properties. Applying a drop of tea tree oil on an open wound can heal it really quick. Peppermint oil. Pain can get relieved on the affected area when one applies peppermint oil. You can apply peppermint oil around the affected area but not on the broken skin or wound directly. If the skin is broken, apply the oil around the wound but not on the wound. Garlic. Garlic has been known for its antimicrobial and antibiotic properties, that is, it can instantly help stop bleeding, reduce pain and promote healing faster. In fact, garlic also boosts body's natural defenses against infection. If the wound is bleeding, just apply a few crushed garlic cloves on it. Making a paste out of garlic and applying it on the open wounds can help treat external infections. Eating garlic helps combat infections that are caused by bacteria that can be spread through the air or food. Onions. Onion has an antimicrobial compound known as allicin that protects the wound from getting infected. Just blend an onion and honey in a blender and make a paste. Apply it directly over the wound to accelerate healing process. Onions also have anti-inflammatory properties which help in reducing inflammation and healing wounds. You can make a paste of onions and apply it on the open wound. It will help kill bacteria before it infects the wound. Mixing garlic and onions in one paste can also help heal the wounds quickly. Aloe vera. Aloe vera has analgesic, anti-inflammatory, antibacterial, antimicrobial, antioxidant and soothing properties that ease the healing process. It is probably the most popular home remedy for cuts or bruise. Cut open an aloe vera leaf and extract the gel. Applying aloe vera gel on the open wound for a few days can heal it completely. Aloe vera gel also has phytochemicals which help ease the pain and reduce inflammation. Cinnamon. The strong antibacterial properties of cinnamon can also help heal wounds. Cinnamon has the ability to fight infections and reduce inflammation. Cinnamon has a component which helps with pain relief. Additionally, cinnamon is also known to help cure burns and heal the skin by cooling it down. It heals open wounds at an incredible pace and is great for healing in general. Coconut oil. Coconut oil helps ease the pain and keeps infections at bay, thanks to its moisturizing, anti-inflammatory and antibacterial properties. In fact, coconut oil helps prevent scarring as well. Applying coconut oil on the wounds can heal them completely and can treat burns too. Coconut oil heals almost any kind of wound and hydrates the skin as well. Coconut oil also has skin hydrating properties. All you will need to do is apply a few drops of coconut oil on the wound and cover it with a clean piece of cloth. You can try this remedy twice or thrice a day for quick relief. Lavender oil. Just like other essential oils, lavender oil too is great for your skin. Applying a drop or two of lavender oil on the cut or wound can help heal it quickly. Lavender has relaxing properties which can help you distress. The anti-inflammatory properties of lavender can help reduce swelling and heal cuts. The antimicrobial properties of lavender oil also prevent bacterial infections and pus. Home remedies work well for cuts and bruises. However, they must be used with caution. When using any essential oil for cuts and wounds, you must mix a carrier oil with it. You can use coconut oil as a carrier oil. Also, before trying out any remedy, you can consult a doctor. Apple cider vinegar to stop bacteria from spreading. Apple cider vinegar is yet another great option to eliminate infection, especially if you have a lot of cuts and scrapes, if you need more convincing that it works wonders. Note, before applying apple cider vinegar to your skin, you should dilute it with water. You can then apply the liquid with a sterile gauze to the affected area for 30 minutes. Another option is to take a warm bath and add a cup of apple cider vinegar to it. It can be very helpful in case you have a lot of cuts and want to target them all at the same time. Tea tree and peppermint oils to relieve pain. Both of these oils help with inflammation and pain. They also act like antiseptics so that the infection doesn't spread further. Although tea tree and peppermint oils have similar properties, they should be applied differently. With tea tree oil, it's okay to put it directly on the wound and cover it with a band-aid. Peppermint oil should not be applied to the open cut to avoid the risk of irritation. A few drops around the area will provide much needed relief. Comfort. Comfort is a natural anti-inflammatory that contains phytochemical allantoin, which enables faster cell growth, improve healing and reduce scarring. Combine fresh or dried camphor leaves with warm water, to make a paste, and place over the wound, covering with a bandage or plaster. Heat. To increase blood flow to the skin and help to speed up healing, you can apply heat to the wound. Put a heating pad, or water bottle, on the wound or place the area in a bucket of warm water for 15 to 30 minutes. To prevent bacterial infections, ensure you wash your hands thoroughly before treating a wound. Baking soda for insect bites. Insect bites can at times be just as painful as cuts. If a mosquito or a bee got you, baking soda is a great way to reduce redness, swelling, and general discomfort. Mix baking soda with a little bit of water until a paste forms and apply it to the affected area for 15 minutes. No more annoying itching in the summer. Chamomile for blisters. Chamomile can provide excellent pain relief after uncomfortable shoes have made life a living hell for your feet. It's also a natural antiseptic and will help the blisters go away much faster. Note: use chamomile flowers or tea bags in a warm cup of water for 15 minutes and then apply the liquid, or soaked tea bags, to the blister by securing it with sterile gauze. Keep it on overnight. Please share with us your go-to home remedy against different wounds. Share your favorite methods in the comment section below. And do not forget subscribe to this channel. Catch you in the next video.